this flow chart just shows the complexity and the integration of the nervous system and brain neurotransmitters and chemical signaling. Cytokines are listed on that chart kind of in the middle there. And that's in rheumatology what a lot of our medications and even our diseases are targeting is cytokine release and production and what our body does with those chemical signals, and how that relates then back into, neurotransmitters, right? A lot of what we deal with as humans is serotonin and dopamine. And, it's all a big feedback. Your arrows point in all different directions, but it's a continuous cycle. And when you have a hiccup in one of those areas, or one is slower than what would be considered balance. I don't like to say normal because in neurobiology, right, like what does that even mean? But when we think about the balance of the body, where is that balance going to settle to where we feel physically and mentally feel like we're living a life that we want to be living versus where we're not necessarily in regulation and things could potentially change. As sort of angled as your diagram is, I also think it's very circular, like cyclical too. It just feeds back onto each other, onto itself, right? And the hormone loops and the hormone cycles and all that stuff again are very cyclic, and all these mechanisms feed back onto themselves. So yeah, I think this is spot on.
In psychology, we talk about the HPA axis and how the cortisol can dysregulate our central nervous system ability to regulate stress in the future. So it sort of results in this sort of snowball or cyclical thing where the longer it's dysregulated, the more dysregulated it becomes. And that makes me wonder about the risk of missing this diagnosis, missing this process, that it kind of snowballs, if I'm understanding correctly, that at some point we have to say something needs to change in order to stop the cycle. And how do we catch that, address it,